The LivaNova Biflow ECMO femoral cannula can be inserted percutaneously using a standard needle and guide wire technique. Under ultrasound guidance, insert a needle into the front wall of the femoral artery and then insert a guide wire. A sufficient-sized skin incision is required to allow the body of the cannula to move freely at the skin level to ensure accurate tactile feedback during positioning of the cannula elbow within the femoral artery. Key points: ensure skin incision is of sufficient size to allow cannula body to move freely through the skin. This ensures accurate tactile feedback is provided during positioning of the cannula elbow within the artery. Sequentially dilate the entry point to the artery by using the dilators provided. Insert the bidirectional cannula, making sure the black alignment line on the front is facing upwards. Prior to insertion, ensure the suture wing is positioned onto the cannula at proximal depth marker. Advance the biflow cannula until the elbow enters the artery, at which point you will feel a loss of resistance. Advance the cannula a further 2 centimeters and then withdraw it until you feel resistance. This means the cannula elbow is correctly positioned for downstream perfusion. Key points: ensure black alignment line is facing upwards during insertion. Advance cannula until a loss of resistance is felt. Advance cannula a further 2 centimeters and then withdraw until resistance is felt. Connect biflow to the bypass tubing using standard de-airing techniques. Hold the cannula firmly in place to avoid unintended movement and slide the suture wing to an appropriate location near the insertion point of the cannula. Reconfirm correct positioning of the cannula elbow by advancing the cannula within the artery and then withdrawing until you feel resistance. When connecting the cannula to the fixation device for the first time, the fixation device clip should be in the central starting position. Connect the cannula to the fixation device by placing the cannula connector with luer lock facing upwards in the fixation device slot indicated by the alignment arrows. A clear click sound indicates that the cannula is correctly positioned. Suture the fixation device to the patient using the fixation device suturing holes. Suture the suture wing to the patient and secure it to the cannula by applying a suture around the circular part. If a reduction in leg perfusion or bleeding at insertion site is detected at any point, desuture the suture wing from the patient and detach the cannula from the fixation device. Disinfect the cannula body near the insertion site and advance the cannula by 2 centimeters. Then withdraw until you feel resistance. If minor cannula position adjustment is needed, reposition the fixation device clip by gently squeezing and sliding it to the required position. Release the clip to firmly engage it in the new position. Reattach the cannula to the fixation device and resuture the suture wing to the patient. Key points: always monitor distal perfusion with an appropriate method and check cannula position if you detect reduced leg perfusion. If minor adjustment is needed, reposition the fixation device by gently squeezing and sliding it to the required position. Once femoral perfusion is no longer needed, remove sutures from the suture wing and detach the cannula from the fixation device. Remove the cannula by applying gentle upwards traction while stabilizing the distal femoral artery with your index finger. Close the arteriotomy by surgical exposure of the femoral artery or by using percutaneous removal and closure techniques. Key points: ensure skin incision is of sufficient size to allow the cannula body to move freely through the skin. Ensure black alignment line is facing upwards during insertion. Feel a loss of resistance as the cannula elbow enters the artery. After the elbow enters the artery, advance the cannula a further 2 centimeters. Withdraw cannula until you feel resistance. This indicates correct position of the elbow and downstream perfusion channel. Reconfirm correct position of the cannula after connecting to bypass tubing and fixation device. Secure cannula to the patient using the suture wing and fixation device. Always monitor distal perfusion with an appropriate method and check cannula position if you detect reduced leg perfusion.